Hi everyone, I'm Dr. Faisel Sayed,
And I'm Dr. Dan McCarter.
and you're listening to Faisel and Friends, where we believe access to primary care is a right, not a privilege.
Today, we're talking to Dr. David Lardizabal, ChenMed's National Director of Neurology, about holistic neurological care. Let's dive right in.
Hello, Dr. Lardizabal. It's so nice to meet you.
Good afternoon, Dr. Faisel and Dr. Dan McCarter. Thank you for having me.
We're so thrilled to have you come join us today. Dr. Dan, it's so good to see you.
Hey, good seeing you again. Yeah, it was great seeing you in person last night.
Yeah, we were just together in New York. It was
Wow.
great to see each other in person, and you know how life is. You got to keep moving. And but Dr. Lardizabal, first, I'm so thrilled to have a national director of neurology with ChenMed. But before we get into what you're doing with the company, I would love to hear your story, where you trained, where you went to school, and then we can get into what you're doing right now, some of the exciting work you're doing with ChenMed.
Thank you for the question. I have a very colorful journey, I think. I grew up in the Philippines, and I was actually the youngest of the family. Um, so we were seven. My parents had 7 children, so I'm the number 7. And I had 4 sisters and 2 brothers. Unfortunately, my mother passed away at a very young age. She was 46, and I was only like 10 years old at that time. And actually, at that young age, this was the first time I saw my first neurological case, so which was my mother. She had breast cancer, and she had brain metastasis, and that was my first experience to witness what Broca's aphasia meant. She was not able to speak, but she could understand me. So it was, I saw the pain and the frustration of her not able to say anything, and their story was not good because she suffered seizures from brain metastasis. So eventually, I witnessed also my first seizure at a very young age. So that's how I really got into my thoughts about neurology being a doctor at a very young age. I thought I'll be a cancer doctor at that young age, but eventually things changed when I was growing up as a teenager. I've, I was very politically active at that time in the 1980s because in the Philippines we were under martial law, so I wasn't very focused in my education then. But it was only after in my college, in my junior year, my father had his stroke, and that was another neurological story that really motivated me to become a doctor. So I saw how the care of stroke was in my country. It felt like a more of an observation. They didn't do much. There was not much interventions then in the 1980s. So I really that's how I got motivated to enter medicine and got very serious with my education. So I got admitted to Cebu Institute of Medicine and did 4 years of education there. And I also participated in community outreach at that time, and I did a lot of community health education. I also joined the Red Cross at that time to do a lot of community outreach. So my parents were the main, unfortunately, their medical conditions were the ones that forced me to witness these unfortunate events, but motivated me to become a doctor. So I actually am an internist by training. I was actually in internal medicine I did internal medicine for 3 years. And there was only one neurologist in my island in Cebu who was the neurologist of my father. And I asked him that I wanted to be a neurologist in my final year in internal medicine. And he strongly lobbied for my for my neurology training in Philippine General Hospital. So I got to become a neurologist in the Philippines. And how I ended up here was a different story, because I wanted to learn more about seizures, and there's no training on seizures in my country. So I wrote 60 letters in United States asking if they would take me for a neurology training for epilepsy or seizures. And only one institution out of 60 took me in. It was a Cleveland Clinic in
Oh
Ohio.
my goodness.
So with 1 month notice, I had to fly. I had to borrow money. I wasn't. It's very hard to be during that time. So I had to borrow money. Took the risk of being rejected. I pleaded my case that I wanted to be an epileptologist, and luckily, Dr. Hans Luders and Dr. Harold Morris, which were the prominent neurologists at that time, were very eager to get me because they saw the spirit and my interest to become an expert in epilepsy. So they really took me under their wing and trained me to be a very good neurologist, I think. So here I am. So I've been here in United States since 1999, and been practicing neurology since 2005. Been mostly an academic neurologist doing general neurology and epilepsy. So that's how my journey is
Oh
in
my
neurology.
goodness. Do- Dr. Lardizabal, thank you so much for sharing that very intimate story, but both intimate stories of your mother first and then your father. We hear these incredible, deeply personal stories that drive doctors to pursue whatever it is that they want to pursue in their lives. And hearing your deeply personal stories, I mean, it touched me, and I just thank you for sharing them.
Yes.
So now you got into academic medicine. You're practicing neurology. You're educating young doctors, I would imagine, with neurology. How did you come in contact with ChenMed?
That's a very good question, Faisal. So I was in Washington University as a general neurologist. So I was doing a lot of frontline work as a general neurologist. I was the senior general neurologist then. At that stage, I still decided I still wanted to learn and be educated. So I joined the MBA program in Wash U in All In Business School. I was like, so they were surprised I was still interested to learn and get to join a graduate school. So luckily they they accepted me, and I told them I wanted them to learn more about healthcare administration. I told them I want to be an academic leader. I wanted to see if I can make changes in healthcare. So one of my classmates was a very strong proponent on value-based care. He worked in Humana before, and our projects in MBA involve also some healthcare projects. So we're trying to solve problems of healthcare costs, and that's how I came across about value-based healthcare. And we're developing technologies or apps that can improve value-based care. And then in LinkedIn, I saw an ad of uh, ChenMed about value-based care and said, "Oh, interesting." But it didn't really cross my mind because they were focused on primary care, and I wasn't. They didn't mention anything about specialists getting involved in value-based care. But I was already thinking of the idea that neurologists or specialties should be involved in value-based care. Then, out of the blue, I received a message from Stephen, one of the talent acquisition recruiters, that if I was interested in about ChenMed. I said sure. So he called me like a day before Thanksgiving, I think, or just that week. And that conversation I thought was going to be short, but it actually was a very long conversation. We talked for almost 2 hours, I think.
Oh
We,
my goodness.
we were just we were just talking about the ideas about value-based care, how it really matched what ChenMed was doing, how to provide VIP care to low-income seniors. And I said, yeah, that's exactly what I'm doing. I think I see people who are low income in the residency clinic. I've been doing preventative medicine. I teach community health. I mentor a lot of students and I mentor PCPs. So it really matched the interest that I had. So the business school influenced me in that. And then somehow I got connected to ChenMed. So it was really like things just moved along well.